Assalamualaikum warahmatullahi wabarakatuh, and a very good day everyone. We will continue with our lecture under the topic of liquid preparations, and today we will proceed with the third part in this topic, which is on the oromucosal preparations. Oromucosal preparations, as the name implies, means that products that are used in the mouth cavity, as it is being called as preparations buccales in Latin. So buccales actually comes from the word mouth. Okay, so this strongly give us the idea that this kind of products is used within the mouth cavity only. So at the end of this lecture, you are expected to be able to define pharmaceutical solutions for oromucosal cavity and their common use, name and list the common ingredients necessary for the buccal liquid preparations, and to describe the functions of vehicle, additive and preservative in buccal liquid preparations. And finally, to describe some examples of oromucosal preparations available in the clinics. So for the purpose of this lecture, we will discuss some preparations. Okay, as an example, we will go through gargles, mouthwash, gingival solution, oromucosal solution and suspension, some sprays, and also mouth paint. Okay, these 6 preparations are the commonly available ones that you will come across, especially as a pharmacist. Okay, for today, first of all, we will try to define first, okay, what are oromucosal preparations. Oromucosal comes from the word oral mucosa, and buccal means that it relates to or involving or lying in the mouth. Mouth is also referred to as buccal cavity. So this originated from the Latin word means cheek. Okay, so the buccal region is actually in this area. And under the tongue is the area where we call as sublingual region. Thus, oromucosal preparation is a pharmaceutical preparation which is solid, semi-solid or solutions. But in this particular lecture, we will focus on solutions only. So this preparation should contain active substances intended for administration to the oral cavity and or the throat, to obtain a local or systemic effect. So this is an important thing that you have to understand, that the administration through the oromucosal cavity can also give systemic effect, which means that the drug that being administered, as an example under the tongue, can be absorbed, okay, under the can be absorbed into the blood circulation. If I want to give you an example, but this is not a solution, this is actually a tablet. For patients that are experiencing heart attack, okay, the medication is actually a form of tablet, in the form of tablet that should be placed under the tongue. So when the medication is placed under the tongue, the tablet will dissolve, okay, and the active ingredient will get absorbed into the systemic circulation. So actually, the sublingual area has a rich supply of blood vessels that will help to deliver the drug that being absorbed through from this area rapidly into the blood circulation. We will begin with the first product under the oromucosal preparation, which is gargles. I think most of us has some experience using gargles, right? So gargles are aqueous or hydroalcoholic solutions used for gargling to obtain a local effect and not to be swallowed. So this is an important thing to be remembered, okay? We have to tell the patient that this should not be swallowed. It is supplied as a ready-to-use solutions or concentrated solutions to be diluted. Most of the times, gargles that are supplied at the clinics or hospitals are in the form of concentrated solution. So we have to tell the patient the method to dilute the preparation. So goggles may be used as prophylactic or in the treatment of the membranous lining of the throat. So when we hear the word goggles, it means that it is used for the treatment of the throat most of the time. Okay, and it may also contain excipients to adjust the pH. So we should aim at a neutral pH. I would like to draw your attention that goggles can be either aqueous or hydroalcoholic solutions, mean that it can contain alcohol. Okay, it may also not contain any alcohol. It depends on the formulation. But remember that this product is for local effect only, and usually is in concentrated form to be diluted, and can be used either prophylaxis. Prophylaxis means in the prevention, okay, prevention of sore throat maybe, or for the treatment, as an example, treatment of sore throat. So as I mentioned earlier on, goggles meant to be used at the throat area, so it should reach the nasopharynx area. Okay, pharynx can be divided into three parts: the nasopharynx, oropharynx, and hypopharynx. So this product, the goggle, should not reach the larynx. It should only reach the pharynx. Okay, so particularly the nasopharynx. And the solution should be allowed to remain in contact with the throat for some time to give the effect that it should exert. Okay. Formulation of goggles, it depends on its indication. So goggles may contain disinfectant or antiseptic ingredients. So antiseptic means something similar to antibacteria. Okay, so it's meant to kill the bacteria and to provide relief to the pain that patient is experiencing at the throat. It may also contain volatile ingredients, as I mentioned earlier on, such as alcohol, and other excipients such as sugar, preservatives, stabilizers, pH adjusters, flavoring agents, and coloring agents, and usually purified water as the vehicle and carrier. Sugar stabilizers, pH adjusters are usually meant to pH adjusters, flavoring agents are usually meant to give the patient the good feeling in the mouth. Okay, we don't want the patient to feel that this product tastes too bad. Okay, because we want them to be able to use the product. So we usually add some kind of sugar and flavoring agents. Packaging and labeling for goggles, usually we use fluted bottles, okay, because it's for external use. And the label should be red in color. We should clearly label it for external use only, and the instructions should explain clearly how the product should be diluted if it needs to be diluted. Some examples of product we have in the market. Example, we have thymol goggle. So the active ingredient is thymol. We also have betadine goggle. The active ingredient is povidone iodine. Povidone iodine is an example of an effective antiseptic, okay, to kill virus and bacteria. And there's some suggestion actually in the literature to use povidone iodine goggle as a prevention against COVID-19. Because it's been shown to be effective in the elimination of similar viruses. So if you think you want to take this goggle as a prevention against COVID, I think it's not a problem, okay, because it's used as goggle. Diflum solution, the API, the active ingredient is chlorhexidine gluconate. I think you can easily see diflum goggles in the market, okay, and there's also diflum lozenges available in the pharmacy.